Chronic Lymphocytic Leukemia, CLL, brought to you by Medicine Isn't Scary. Don't forget to subscribe. Well, I understand that leukemia can sound very scary and overwhelming, but what if I tell you that CLL is often so slow-moving that many people can live with it for years, even decades, without needing any treatment at all? It's a fascinating and unique disease. So by the end of the video, you will understand exactly what CLL is, how it works, and how is it so different from the dramatic leukemias that you usually see in movies. Let's get started. So let's first off by breaking down its name. Chronic means that it's slow growing. Lymphocytic means that it affects the lymphocytes, a specific type of white blood cell that is a key part of your immune system. And leukemia means that it's a cancer of a blood and the bone marrow, which you could imagine it as your blood cell factory. So you could imagine that your bone marrow is a super efficient factory that produces all your blood cells. In most leukemia, the factories get taken over by areas of immature, out-of-control cells. It's like a fire that needs to be put out immediately. However, CLL is a bit different. A better metaphor for CLL is, it's just like a clutter. In CLL, your body starts producing too many mature-looking but actually very lazy and dysfunctional B lymphocytes. So if you guys have watched my previous video, you would remember that for ALL, your bone marrow factory is producing some immature lymphoblasts. Remember? They were lymphoblasts. They were immature, acute, younger, short time. They were immature, okay? Remember, for CLL, they were mature. Got it? Make sure that you don't mix them up, okay? So, after building a lot of mature looking but actually lazy and dysfunctional B lymphocyte, these cells don't die when they should, and they slowly accumulate inside your blood, lymph nodes, spleen, and bone marrow, which eventually crowd up the healthy cell and paralyze the immune system. So, why does this clutter happen? How does it happen? It actually all comes from a genetic glitch. Normally, when a B cell is born, they usually fight, and then after their work is done, it's politely self-destruct. And this is the process, what we call as the apoptosis, left upper abdomen. Okay, so many of the case, especially for our patients, patient may just come in telling you, I don't really feel like eating these days. I'm feeling really full. And usually when the patient tell you this, and when you touch the left upper quadrant and you realize that, oh my God, it's really a bit tenderness. Okay, and then fourth, of course, you're feeling pretty tired, okay? Because the cluttered bone marrow struggle to make enough blood cell, anemia can develop, leading to profound tiredness and paleness. And last but not least, it will lead to some immune system problem. This is a huge one. Remember those lazy CLL cells? They cripple in the immune system. So people with the CLL are far more susceptible to frequent and severe infections. For example, leukemia, sinus infection, even they start any treatment. Now, what are the potential complications? You need to know that the most common serious problem is actually related to the dysfunctional immune system that could go haywire. The primary emergency we watch for CLL is what you may think. It's not this cancer that keeps spreading, but instead it's when the confused immune system start attacking itself, attacking the own healthy blood cell. And that is what we call as the autoimmune complication. And the most classic example here is the autoimmune hemolytic anemia. So what is an autoimmune hemolytic anemia, or what you know as the AIHA? So here you can tell that the body is actually destroying its own red blood cell, okay, and suddenly causing severe anemia, and therefore someone will feel extremely tired, shortness of breath, and then they will look jaundice, okay, which is very important here. You need to remember the word jaundice, okay, because the body is destroying its own red blood cell, right? Therefore, there will be a lot of red blood cell breaking down in a very short period of time, leading to jaundice, okay? So this is a medical emergency that require immediate treatment with steroids or other therapies. So another rare but serious complication is when CLL transforms into a much more aggressive lymphoma, which is called as a Richter's transformation. We'll have video talking about this concept later. So how do we treat this? Do you think we'll cure or control CLL? Well, you may think about it's a blood cancer. Of course, we're starting with chemotherapy, right? Well, then you're wrong. In CLL, the treatment goal is actually not about cure, but rather it's about control. It's because it's a chronic disease. We aim to manage it, control symptoms, and help people live a long and high quality life. This leads to a key point that often surprises many people. We don't actually treat CLL right away. If someone has no symptoms at all, we often just ask them to monitor because early treatment has not been shown to help people live longer. And we can always avoid the side effect until they truly need it. So when a treatment is truly needed, it's usually due to the worsening symptoms, for example, like falling blood counts, bulky disease, and we have moved away from the harsh chemotherapy. So now the first treatment is actually called the target therapy. Okay, so for the target therapy, there are a type of medication is usually taken by the patient, which is the BTK inhibitor. These are the oral pills like ibrutinib or acalabrutinib. So they were brilliant. They work just like a specific key that jammed the lock on the CLL cell survival pathway. They tell the cancer cell, hey, your time to die, while it's largely sparing healthy cell. It's not a blunt instrument like chemo, it's a precision strike. Another great option is what we call as the venetoclax, which blocks different survival protein inside the CLL. Okay, so just to recap, CLL is not a fire. It's a slow-moving clutter of lazy lymphocytes. It's often found by accident, might not need treatment for years. And when it does, we have amazing targeted pills that can control it effectively for a very long time. Basically, CLL is a journey of monitoring and management, and the prognosis of CLL has improved dramatically thanks to those new therapies. If you learned something new today, give this video a thumbs up. It really helps the channel. And I'd like to hear it from you. Did any of these information surprise you? Are there any other medical condition that you'd like me to break down in a future video? Thank you so much for watching. See you in the next video. Bye-bye. Remember to click the like button and subscribe our channel so you will never miss it out.